start and start. We are ready.
All right, well, it's 10 o'clock and welcome. Our purpose of this special meeting today is to interview candidates for the Memorial Hospital Board. And so our first interview this morning is with Anthony Spiegelberg. And Anthony, welcome. And so if you would just introduce yourself to us and tell us about your interest in serving on the hospital board.
Okay, thank you, Chairman. Anthony Spiegelberg, it's interesting. Seems like lately I've been on the other side of the table interviewing people instead of being interviewed, but I'll do my best. I have been here in Sheridan County for about 27 years, served on numerous boards within the county, within the city. And back in, I think it was 2000, I served from 2000 to 2009 on the Sheridan Hospital Board. I was appointed at that time, filled an unexpired term. I believe that was by Frank Bartolini at the time, and then served another 5-year term after that. And have always stayed in touch closely with the hospital. It's, I think, one of the most important boards in our community. When we're sick, when your family's sick, it becomes as important as anything. So I've always kept an interest in it, supported the hospital from a volunteer standpoint, my wife Jean and I, and it's just a pillar of our community and one of the things that I enjoy staying in touch with. I enjoyed my time on the board. And when I learned that Gene Davis was interested in not fulfilling the rest of his term, we had a discussion about whether my skill set might be able to step in and help right away in filling his role. And I think that it can, and I think I could fit well with the rest of the board.
All right, any other questions from you?
I have a couple of questions. Mr. Spiegelberg, right? Get it. My first question, of course, is Title 18.8.102A says that any board member of the Board of Trustees cannot be an employee of the county hospital. I'm verifying, first of all, that you're not in any way, shape, or form.
Commissioner, I'm not. I would disclose that my wife is a locums employee. She works maybe, well, in the summertime a little bit less than the winter, but she'll work an average of maybe 2 days a month, filling in at various offices in an administrative role. Other than that, I am not employed by the hospital at all.
Okay. Thank you for letting us know that. Secondly, I always ask this question in these interviews. What do you see that the board is doing really well, and maybe some places that you think you could improve with you being a trustee?
Well, I think a lot of things have changed since I was a trustee back in 2000 to 2009, but a lot of the things are still the same. It's still healthcare, and when you're sick and need help, people don't care about all the administrative tasks that a board is responsible for. They care about getting taken care of when they go in the emergency room or into the hospital. So I think those things haven't changed, and I think the board has done a good job of trying to be forward-thinking in what they do. In healthcare, there's a lot of things that you don't have control of. The federal government or the insurance companies or others have a lot of control over what you can and can't do and how you're reimbursed for that. So I think the board's done a good job of adjusting. They've put a lot of the physicians on staff now versus being private practitioners, which is what most of the physicians want in the market today. So that's been a good thing, I think. They've expanded into areas that of community need right now, of course, the mental health activities, cancer care. So I think they've done a good job with that. Looking back as a board member, I think the most important thing a board can do is hire the right CEO. And I was the chairman of the search committee when we hired Mike McCafferty and board vice chair at the time. So I look back at that and say, what did we get right? And we got the right CEO.
Yes, sir. I'm wondering, would you be supportive to actually gain better ground in partnerships with our closest bigger hospital and to try to fill some of the gaps that we might have in shared in this area for better healthcare, would you be supportive of measures to try to do some of that work?
Short answer is yes. I think if you've been exposed to the report that Mike McCafferty provided to the community, and I think he presented to the commissioners a couple months ago. It's kind of a scary world out there in healthcare of consolidation and technology changes and reimbursements changing. Our community is getting older, as we all understand, and so that changes our payer mix. We don't have as many insured patients as we used to. We have more that are Medicaid, Medicare, which don't reimburse as well. So I think that we have to keep an open mind. I think that there's going to be technology changes. There will be changes in personnel. And we have to be open-minded to that. I think we all want to maintain as much independence as we possibly can as a community hospital. But I think it's a good thing, and we should look at partnering where it makes sense. We have wonderful specialists in certain areas and other areas that we probably never will have a full-time person here right in Sheridan. So I think we have to consider those, make sure that they make sense, make sure that our medical staff is on board with it. When it comes down to it, they're the decision makers and the ones making the tough decisions for our healthcare, and they need to be a part of the decision process as well. So yes, I think we should be open-minded to that.
Thank you.
Anthony, I'm the liaison to the hospital board, so I've seen you at several of the meetings there. And you mentioned that you thought you would fit well into the role that Mr. Davis would be departing. Maybe just a little bit for the benefit of the rest of the board as to what role he kind of had on that board and how you feel you could fill that role.
Well, most recently, as you're aware, Gene Davis was the treasurer of the board. That's a role that I also filled back I think in 2005 when I first came on the board there. I have a background in finance, and I think that's helpful, and along with my experience on the board as treasurer before, I think I can immediately have a good solid footing. The hospital's a very complex business. Certainly took me a couple years to get my feet on the ground with it and understand the ins and outs. And you never are the one managing the hospital. That's not your role. Your role is to hire the right CEO, and we, I think, did that the last time. And I think that Gene has been a very solid financial mind for the hospital during times that are really challenging. When I was last on the board, we had, I think, somewhere around 60 or 70 days of cash on hand, and now the hospital's down to somewhere around 20, depending on the day that you look at it. It's a big number when you look at what it takes to run the hospital. The cash burn at the hospital is over $400,000 a day. So somewhere between $10 and $12 million a month. It's a big business. So I think there's been some loss of days of cash on hand. I think that would be important to start building that back up as best we have control to do that. Rob Johnson, who I haven't worked with a lot, but I know Rob has a financial background. I would hope that I could be helpful in perhaps mentoring him some with what's going on within the hospital's balance sheet and income statement. So I think I could step in and immediately have some role. It would be up to the chairperson as to what that role might look like. I'm happy to do as much as they need. I've got the time and the interest in doing that. So whether that's as treasurer or in some other role, I'm happy to do whatever works out.
Well, and I think you mentioned something there too. I mean, we have a rather new, fairly new board member as the chairperson now. So I think the seasoning that you have could probably help with that area and help her a little bit too. So anyway, all right. Well, is there anything you'd like to add, Anthony? Yeah.
No, I just appreciate your consideration. I'm here in the community. I've served on a lot of different boards, and some may be more successful than others. And I think in my prior service on the hospital, probably learned a few things and that might be helpful going forward. And I appreciate your consideration.
All righty. Thank you, sir.
Thank you.
Appreciate it. See you later.
Thank you.
With that,
Do we need to make an announcement about the other?
yeah, I will. We had one other applicant, Scott Adele, and because he realized that probably his business might be a little bit of a conflict of interest, he has withdrawn his application. So we don't have any other applicants to interview today. So with that, at 10:10, adjourned. Thank you.